Welcome, ladies and gentlemen. Thank you for joining us for today's webinar. My name is Samya Andrabi. I'm the assistant editor at Clean Middle East magazine and your host this morning. Today, the topic of our webinar is one that has taken the world by storm. Since its first case was reported in December 2019, the novel coronavirus has claimed approximately 560 lives in China. More than 20,000 cases have been confirmed in China, and the numbers are only expected to rise in the coming weeks as it spreads to 20 more countries. In this webinar, organized in association with TCL, we'll be discussing how to combat coronavirus through an infection control perspective. Just a few details before we get started. If you have any questions during the presentation, please type them into the question box on your panel and I'll bring them up during the webinar. We'll also have a quick Q&A session with our expert in the end. While we talk, you can also download a free ebook in association with TCL, Combating N Coronavirus, which highlights the top infection control measures across hotels, hospitals, and airports. Now, without further ado, we'll turn over the time to Ms. Patricia Ollinger, Executive Director, Global Biorisk Advisory Council, a division of ISSA, who has joined this webinar from the US. With valuable insights from Patricia, you can learn about coronavirus and infection control in hotels, airports, and hospitals. Thank you for joining us today, Patricia.
Thank you. I'm very happy to be here. With me today, I also have some of our Global Biorisk Advisory Council, GBAC, Scientific Advisory Board members, and Mr. Jeff Jones, who is a forensic operator and owner of Biosheen here in the United States. Mr. Doug Cunningham, who's from Georgia Clean, who's also from Forensic Restoration Organization. Dr. Stefan Wagner from Health Canada, he just retired recently. And also Mr. Stephen Leong from Context. So we're very happy to be here.
Welcome all board members to our webinar. And we hope that it's going to be beneficial for the audiences who've been waiting for quite a while. So without further ado, Patricia, tell us about the novel coronavirus that the WHO has declared an international emergency.
So as we've all seen in the news, this is a new coronavirus. It's very similar to SARS. It has surpassed SARS as far as the number of cases that we've seen, as well as the number of deaths that we've seen. It is, getting to the point where, a lot of people are feeling that it should be or will be considered a true pandemic. All of us around the world are concerned about what that means and what we need to do to prepare, respond, and then at the end recover from this new virus.
Okay, what is its source and what are its common symptoms?
Well, the source is still being discussed. I mean, scientists have looked at a couple different potential scenarios. They've talked about it coming from bats, from snakes, and they're still researching some of that as to where the actual source was. It is truly believed to be a zoonotic, meaning that it did come from animals then moving into humans, just as SARS or MERS has been. And then you had one more question there. The symptoms. The symptoms are very similar to what we see with flu, common cold, as far as in the beginning. The cough, the temperatures, or the fever, and one of the concerning part is the upper respiratory distress, which the pneumonia that seems to be the symptom that a lot of people are having the most difficult with.
Okay, and you said that it's very similar to common cold, its symptoms in the beginning. So, how can people tell the difference between a common cold and flu and coronavirus when they start experiencing general symptoms like cough?
That is a very difficult. That's very difficult. It's a great question. I think that's one of the concerns as far as a disease like this, or not a disease, but an infectious agent like this. When we look at it, is that it does. Most of us, when we get a common cold or even the flu, we don't go to the doctor, and in this case, that means that people are out and about and in public areas with each other. So that is very concerning, and that's one of the challenges that we have.
So, what would you recommend to people who experience these symptoms in the beginning, who are not sure if it's coronavirus or not, who are not sure if it's coronavirus or common cold? What do you recommend to those people?
Well, if it were me, there's a couple things that you can think about. First of all, if you are ill, if you don't feel well, you should, stay home, not go to work, not go into public places. If it is one of those, and that's a really important thing to think about. The other thing is to pay attention to what is going on in your country and in your area. If you're not seeing right now, here at least in the United States, and also in the Middle East, we haven't seen a lot of cases yet, and so the relative risk for if you start having cold symptoms, that it would be the coronavirus, it's probably pretty low. But if we start seeing cases that pop up, and we start seeing the spread of this virus into our countries, that's when we start being a little bit more concerned. And that is also when, if you do have symptoms, you would consider going to the doctor more immediately than waiting.
What are the major touch points wherein the risk of cross contamination is the highest in an outbreak like this?
Okay. Places where people get together, where they public places, especially events that they may go to, schools, a lot of those situations like that. Obviously, I know that one of the questions that you had posed earlier, that you had sent earlier, is like airports, hotels, uh, uh, transportation, those kind of situations and those areas. And obviously it's the touch points. It's the places, door handles, the flat surfaces, where somebody may have coughed or sneezed. And those are the types of situations that you would be very careful about.
How exactly does this spread from person to person?
That's a good question too. In the beginning, they said that there wasn't much. They didn't think that there was human-to-human transfer, and they know now that there is. They also know now that there is an airborne transport, or that there's you can get infected through an airborne transmission. So there's a lot of that is a concern in a virus like this. Much more likely to have that pandemic happen.
Okay, so what are the general cleaning, hygiene, and infection control procedures that all facilities that have a large influx of people must take?
Looking at your cleaning procedures, number one, that is such an important aspect. I'm going to speak a little bit, and then I'm going to have some of my panel members speak on this as well. But
Sure.
really pay attention to those cleaning procedures, making sure that you're doing that. Also, taking into consideration the use of electrostatic sprayers and appropriate disinfectants after you've cleaned, to be able to follow up with some of the new technology that's available to us, as as I said earlier, the electrostatic sprayers, or some of the new ionized hydrogen peroxide sprayers, the Tomy Thermos. those are systems that are out there that really add to and help us, disinfect, clean, disinfect, and protect against the spread of this virus. Jeff, do you have anything to say?
As a forensic cleaner, I think we need to first take a look at what is cleaning. Cleaning is defined as the removal of soil, both visible and invisible. And then we have forensic cleaning, which is defined as the removal of biological contaminants, both visible and invisible, to prepare surfaces, both vertical and horizontal, for professional disinfecting. In the flow of a logical conversation, the next question would be, what is professional disinfecting? Professional disinfecting is the application of a hospital-grade tuberculocidal disinfectant with a 6-log kill, proven to kill both gram-negative, gram-positive bacteria and inactivate both enveloped and non-enveloped virus. This particular strain of coronavirus that we're talking about right now is an enveloped virus. So we always ask ourselves, what are we cleaning and why? There are two types of cleaning. There's interim cleaning and there's corrective cleaning. So you cannot disinfect a contaminated surface. It needs to be cleaned first. Interim cleaning is what's done on a regular basis. Corrective cleaning is what's done after an incident or suspected exposure. So we clean something first to prepare those surfaces for professional disinfecting. And then something like this, in the case of a coronavirus or any infectious agent, we're going to up the frequency of that.
Stephen, do you want to add anything?
Yeah, so as Jeff was saying, the frequency needs to be increased. And so when I think about specific places where people are likely to come in contact with others, I think about transportation centers. For example, in places where you have light rail, or you have buses, or you have taxis, these are all places that need to be cleaned much more frequently during a situation like the spread of coronavirus. You can have very thorough daily cleaning, but the reality is when an infected person sneezes or coughs or in another manner deposits infectious material, now that infection can be spread. And so there are some new technologies out there. For example, when I think about rails or loops that people can try to hold on to on a light rail car, those are not so easy just to wipe down, especially if they are the hanging loops. But as an adjunct to effective cleaning, you can use a device, as Patty mentioned earlier, a device such as a Sterimus machine, a BioPlanet machine, or even a Victory sprayer with a disinfectant that is similar to what Jeff described a little bit earlier.
So think about common use horizontal surfaces, and these could be found in any dining facility, which need to be cleaned and disinfected after each person or party leaves that area. Think about common use horizontal surfaces where countertops, like at banks or hotels, registration desks, which are going to have to increase their cleaning and disinfecting frequencies.
I think that Jeff touched on this a little bit, but I'd like to go into it a little bit more. There's also the aspect of the our personal hygiene. Washing our hands is so important, to control, to protect ourselves, to protect others, and to control potential contamination spread. Washing our hands with soap and water for 20 seconds. And 20 seconds doesn't seem like a long time until you're washing your hands and actually washing them for 20 seconds. But we always tell people to sing the happy birthday song and twice. And it just takes quite a long time. And when you do wash your hands, make sure that you're really washing all surfaces of the hands, in between your fingers. Avoid close contact with people who are sick. If you've been out and about in your community, try avoiding your hands taking your hands and touching your face. Dr. Gavin McGregor Skinner, who is on our board, who was with us earlier this week, he says avoid your holes as far as your nose, your eyes, your mouth, or if you have any abrasions on your skin. And that's where infectious diseases and infectious agents can get into your body. Cover your mouth and your nose, if you sneeze or cough, and then clean and disinfect frequently. Frequently touch surfaces. And so when you're looking through your facility, when you're doing your site assessment and trying to decide what you're going to do and how you're going to do it, look at those high touch points and make sure that you clean and sanitize those high touch points.
One thing I'd like to add on to what Patty said a little bit is that aspect of personal hygiene. One of the things that also came up in an earlier webinar with people around the world today was that the use of hand sanitizer. There were questions as to how effective hand sanitizers were. Would hand sanitizers work specifically on this virus? If you read the label on hand sanitizers, they actually require application and working on the hand sanitizer for up to 30 seconds, depending on the chemistry. If you're using an alcohol-based hand sanitizer, especially in a hot environment, that alcohol and the water base may actually flash off before that 30 seconds is up. And so keeping enough hand sanitizer on your hands to keep the skin wet for 30 seconds is going to deliver the type of efficacy that the manufacturers tested for and intended.
Okay. And what are the different kinds of PPE infection control specialists and housekeeping staff must use while maintaining a hospital, hotel, or airport?
It's a very good question. We get that quite a bit lately, and I would say that it depends on the situation again. The situation being, are you expecting is there a suspect patient that has been there or that you expect to have been there? Is there a patient or a person who actually is infectious that is in the area such as in a hospital? Those are going to be different scenarios. So we'll talk about in the event that, let's say, there has been a suspect patient or a patient that is actually there in the area. So number one, the cleaning staff and the EBS staff, if they are going into those areas, they're going to need to, wear gloves, wear a face shield, and wear a respirator if there's a patient there. If they're going into an area where, and I'll back up just a little bit, as well as I would put on shoe covers so that when you go into that area, you can do your cleaning, your sanitization, disinfection, and as you come out, you're going to remove those shoe covers so that you're not spreading contamination to other parts of the facility. If you're going into an area where maybe there was a patient, but they no longer are there, then it's a situation where unless you're going to be creating an aerosol, unless you're going to, by the mechanism that you're cleaning and sanitizing and disinfecting, a mask, I would still put on a mask, like a surgical mask. But if you are going to be creating that aerosol, we would move into some type of a true respirator. Here in the United States, we refer to those as like an N95 respirator, or a lot of what our team uses is a powered air purifying respirator for those types of situations.
Let me touch on gloves for just a second. Nitrile gloves are commonly used by people who are working in the housekeeping industry. It's pretty typical to wear nitrile gloves when working in things like toilet areas or public washrooms. There is a difference between common industrial nitrile gloves and medical grade gloves. The medical grade gloves have been tested for pinholes and are pinhole free. However, industrial gloves can have small pinholes in them. So for situations like this where you have a spread of coronavirus, we recommend using medical grade gloves.
Very good point. Thank you, Stephen.
Okay, while we talk, I'd like to remind the audience that if you have any questions during the presentation, please type them into the question box on your panel and I'll bring them up during the webinar. You can also download our free ebook in association with TCL, Combating N Coronavirus, which highlights the top infection control measures across hotels, hospitals, and airports. Now, coming towards our next question, airports, hospitals, and hotels are different in the kind of audience, in the kind of uh, uh, footfall they have. So, what are the specific actions that must be taken by airports when it comes to combating the virus, considering that different flights are coming from different countries and you might not know who is infectious and who is not?
Very, very good point. That was discussed in an earlier webinar as well, and in other conversations that we've had. Airports are actually very challenging because of all that you just said. You have a lot of people that are moving through those airports. They're coming from all over the world. We talk about, a pandemic as one plane ride away, and we're so interconnected, more so than we ever have been in our history. That being said, it is extremely challenging when we're looking at a facility such as an airport. That again, that constant and that periodic cleaning is so important, and it's and as soon as you're done, you have to start all over again. And then taking that step, there are systems out there after you've cleaned, as we had talked earlier, that you can spray even when there are people around in certain locations, using some of the electrostatic sprayers and some of the new solutions that are now out there. That some of these solutions are even effective against the coronavirus. And so looking at those, that constant cleaning, and in this situation, you may need to step up the frequency of your cleaning, sanitization, and disinfection processes. Hospitals obviously are a little different. Hospitals, they have, people sick are coming to the hospital. I mean, that they're ill, and especially if we do experience a pandemic and you're starting to see more patients you're starting to see patients that are either suspect or confirmed that they have the coronavirus. You're looking at, again, it's time to review our procedures and decide what it is that you're going to do in the event that we have a pandemic and have individuals. I would say there's a couple things. Think about how you are looking at just the flu season. How are you stepping up your cleaning procedures and your sanitization and disinfection? Also, if you were to have a MERS patient, in as far as how have you handled in the past, the situation if there was a MERS patient, and those symptoms or those procedures that you followed in the case of MERS would be the same procedures that you would follow here. Hospitality and hotels, again, as we're looking at and preparing for a pandemic. The same situation as Jeff indicated earlier, the types of interim cleaning or interim and corrective cleaning, looking at those and ensuring that, we're again really taking into consideration how we're cleaning. And then again, that disinfection, we don't necessarily do that disinfection step. And it's so important because we all know that we miss those touch points. And some of these new pieces of equipment that are out there, this new technology that we now have available to us, that when, just even a few years ago wasn't there, really helps in, as we call it, we're microbial warriors. It helps in that fight and that war against a virus such as this. One other thing I would like to go back and state about the hospital situations is the triage procedure. as people are coming into the hospital and your entry points into the hospital, a lot of times when during the Ebola outbreak in 2014, I was actually with Emory University in Atlanta, Georgia, and I provided support to the unit that treated the 4 Ebola patients that had come to Emory University. One of the things that we did in our healthcare system, because we have several hospitals within our system, we looked at the entry points and looked at the procedures that were in place as to how we would triage patients as they came in that were potentially or suspect patients with Ebola. The same type of procedure needs to be in place here. What are your entry points into the hospital and your clinics, and how are you going to handle patients as they come in who are potentially who are suspect patients?
May I add something?
Mm-hmm.
Yeah. When you look at some of the airports, hotels, and hospitals, the Middle East and Asia have some of the newest facilities. And so some of these facilities have wonderfully advanced technologies, and others may be a little bit older. One of the things that we've come across in the United States is we have a lot of older hospitals that maybe don't have so many of the new technological designs or features in them. And so when it comes to working with an existing facility to combat the virus, recognizing that the virus can be spread in an airborne manner, we've talked with facilities about being prepared to actually enhance their ability to isolate patients within a room. And so restricting things like airflow or creating what you term an anti-room in the clean room world or a transition zone in the restoration world with things like polyfilm, tape, zip walls. Those are contingency plans that a lot of hospital staff haven't necessarily thought about. Your clinicians don't tend to think about things like that. Your environmental service people don't tend to think about things like that. Perhaps the engineers or the maintenance people that hire remediation companies to come work on projects such as a water loss, those are the people that tend to think about things like that. But ensuring that your hospitals have supplies available to facilitate perhaps the erection of temporary isolation areas that may need to be bigger than what they are accustomed to handling, as well as ensuring that the personnel are trained before they actually have to build one for use is actually pretty critical. One of the things that Patty mentioned also about triaging, I think can actually apply to airports as well, and I think is already done to some extent, and that is using touchless sensors, for example, to read the temperatures of inbound passengers. If you can, maybe triage isn't the right word for an airport, but if you can segregate the people coming in from other countries who actually have a fever and then do more specific interviewing and perhaps sending them for treatment at a facility, medical facility, that may actually be another step that your country may decide to take when it comes to combating the virus.
Okay, we have a question from the audience. Mr. Louis from Specialty Hospital Jordan asks that are latex gloves enough or should we wear double gloves and also wear gowns?
Last question.
Do you need to double glove and do you need to wear gowns?
Oh, gowns. Yes. You know, again, the question about double gloves would depend upon what it is that you are actually doing. And so what I would recommend is that you sit and you look at your scenarios, what we call our risk assessment, and determine, you know, what you're going to do. If you have the high potential of contamination on your external gloves, if you have double gloves, then you can take your outer glove off and you still have fairly clean, or hopefully clean if you've taken them off appropriately, the doffing or the taking off of your personal protective equipment when you've been in a situation where there is an infected patient, that is when you are most vulnerable from a standpoint of being exposed as you're taking off your PPE. So the double glove issue, look at what you're actually going to be doing, and if there's the high potential, a trach tube, moving things in and out, where you potentially are going to get infected material on your gloves, that is when you would, consider wearing the double glove again, so that you could take off that outer glove, and then you would have you're still protected with that inner glove. In my healthcare, when I provided support to healthcare, we would, even after you've taken that outer glove off, we would then use an alcohol wipe on our inner glove. Gowns, yes, absolutely. The gowns are one of those things that they're protecting you, and they're protecting your other patients, because as you are taking care of this patient, we would then take those gowns off. In fact, we would probably be wearing either a Tyvek suit or something that's disposable, that then we would then, before we would go out into a clean area, or into, if you were going to see another patient. Because the last thing you want to do is to take that infected material into either your nursing staff, your healthcare staff, your physician staff, or into other patients.
I'd like to clarify also that this would be for both clinicians as well as the environmental service or housekeeping staff. Often when a patient transitions out of an isolation case room, the room needs to be cleaned, terminally cleaned afterwards. And there may be a need to clean the room while the patient is in there as well. So if the environmental service technician or housekeeper actually goes in there, they do need to gown up, and double gloves are generally recommended if they're going to be handling infectious materials.
So I think the other thing that we tend not to talk about is, in a hospital setting, our visitors. And so if you have family members who are coming in, they really need to be protected as well. And that's one of the things that we sometimes tend to forget. And they're not skilled in how to put things on or take things off. And so there's a lot of, hand holding, as we would say here, of the family members in that kind of a situation. One thing, again, that we didn't talk about in the personal protective equipment right here, which we talked about earlier, is the use of respirators and masks. If you have an individual who is infected, then you should be wearing a respirator. And, there are a couple things to think about. If you have beards, if the men who are going to be wearing a respirator has a beard, then they really cannot wear what we would call a mask, an N95 mask that has the seals around the face. That's when we move people that's one of the situations where we move people into a powered air purifying respirator. And so those are the situations where you'll see people with the really soft helmets kind of on. And there are multiple reasons why those why we like those, but one of them also is the comfort that people have. You have HEPA filtered air that is blowing over your face, and if you're in a patient room and you're having to wear a respirator for any extended length of time, whether you're cleaning or whether you're providing care to the patient, it's very helpful to be as comfortable as possible. And the protection factors that those types of respiratory protection provide you is much higher than just from a surgical mask or an N95 respirator.
One thing that is very, very important when it comes to the use of personal protective equipment is the actual doffing or removal in a safe manner. One of the things that we've seen is that when people are given new procedures, such as you're now to wear double gloves and you need to tuck in the gown underneath your outer glove, for example, if that's a procedure your hospital adopts, taking off that setup, if done improperly, can actually give a false sense of security to the person wearing the personal protective equipment and actually get them infected. So there's a tool that we use in training that goes by the commercial name GlowGerm. I think if you Google it or look for it on Amazon, you can buy GlowGerm, and it's actually an ultraviolet sensitive powder or lotion that can be put on the outside of gloves. When we train with GlowGerm, we'll have people put on their gloves, single gloves or double gloves. We'll put some of the GlowGerm on, they'll smear it on those gloves, and then they'll start to take the gloves off. There's a specific technique that we train with also that is referred to as the beak technique, B-E-A-K, like the beak of a bird. And if you Google that or look for it on YouTube, you can find that technique, video on that. But when using the beak technique properly, gloves can be removed without getting any of the pathogen, or in the case of training, GlowGerm on their hands or anywhere else. An ultraviolet light is used, which causes the GlowGerm to glow or fluoresce, and it's a really good training aid for your people. In addition to training, one of the things that we have our trainees focus on a lot is do it right, don't do it fast. You're more prone to mistakes when you do it fast. When you make mistakes in a situation like this, people can get sick and people can die.
Thank you. One other thing about the GlowGerm. I've done in the past training in Abu Dhabi and Jordan, and also in Oman and Kaust in Saudi Arabia. And we found that we couldn't necessarily find the GlowGerm. So if you cannot find GlowGerm, there are other things that will fluoresce. You need to have like a little flashlight that has that fluorescent, that UV light that you can move over your hands or over your personal protective equipment. But some of the common laundry detergents will fluoresce. And so you get your fluorescent light and, go through your house and look at what potentially fluoresces. In addition to that, sometimes certain types of things like peanut butter, believe it or not, will fluoresce. And they're, as Stephen indicated, there are fantastic tools for teaching individuals proper doffing, how to take off their personal protective equipment.
We have a question from the audience. Mr. Galal asks, do you think checking the temperature of those who arrive at the airports is really effective? Because someone can have the infection but doesn't show the symptoms for 12 days.
It's a good question. Yes, I think it is. It's at least when you do identify somebody with a temperature, you at least know that they, especially if they're coming in from those areas where we're seeing higher incident rates of the virus, then yes, I think that if they come in and they do have a temperature, at least okay, I need to look at this individual more closely. That's one of the concerning things about this virus, and that we're hearing is that are people potentially infectious before they have symptoms? And there's been some mixed reports out there the last couple of days. And so we're still kind of paying attention to that and trying to understand that.
Okay, another question we have from our viewers is from Shanti. She asks, what kind of training must be given to cleaning attendants in such scenarios in any of the facilities?
Well, what we like to tell people is GBAC training. We actually this week just finished our 2-day fundamentals course. We call it our fundamentals course, but it's our technician level course where we take people through the scenarios that we've talked about here today and actually have them use the equipment. We have them learn how to use personal protective equipment, how to take off. And so all the things that we talked about today are things that you should be training your folks on, as far as how, how are they going to do that site assessment? How are they going to enter into rooms? How are they going to clean the room? How are they going to then exit the room? How they would disinfect the room, how they would exit the room, how they would take their personal protective equipment off. All of those aspects and all of those steps need to be looked at and need to have training on those as well.
Okay. Another question from our viewers is from Mr. Lue again. He asks, what about emergency preparation for suspected patient? What should be taken into consideration regarding not spreading the infection in hospitals?
Again, that triage part where looking at your points of entry. So one of the things that, you look at, and even, as patients come in, and I'll take an emergency room as an example. As someone were to present at the emergency room, usually somebody is asking questions, what's going on, they get that data, in a situation, and lots of times we call that critical incident data. And in this situation, your patients are coming in, you're getting that information from them. And when you find out that if there's the reason to suspect that they might have the coronavirus in your countries, in your region of the world, and right now here within the United States, we would be asking them, have you traveled in the last several days? If they have, where have you traveled from? And if they have come from the Wuhan area or the China area, or even the question of, is there a reason that you would believe that you have been exposed to the coronavirus? When they're asking those questions, it helps you triage, and it helps you then prepare for, okay, we have a suspect patient here. And again, looking at your procedures that you had in place for MERS, looking at procedures that you have in place for flu or tuberculosis or some type of upper respiratory disease, infectious disease that really you already have procedures for, and to kind of, what we would say, dust those procedures off and look at those and take your staff through those as far as asking those questions. Are we ready to do this? Do you have, the PPE that you want, the personal protective equipment that you want to wear? I hope that helps. I'm sorry, you're breaking up. I'm sorry, you're breaking up. Uh-oh. If you advance to the next slide, we could read the question on the slide. What about hotels and hospitals? What kind of cleaning hygiene tools? What kind of cleaning hygiene tools and solutions, chemicals, equipment, and general cleaning innovations must be used for infection control in such scenarios? So in some respects, this is a confusing part of this, as well as kind of, for us, one of the fun things as far as when we look at the equipment and how we do things and how we implement things. So the chemicals are one of the things that we're finding is kind of for us, confusing. And what we recommend is that you really strongly need to look at the labels of the chemicals, and also look at, what the manufacturers are saying, and do they have what we call a claim against the coronavirus? And that's extremely important. In general, what we're finding are things like the vaporized hydrogen peroxide, which comes for professional disinfection. Chemicals such as chlorine dioxide. There are new formulations of chlorine dioxide that are available to us now that are what we call stabilized chlorine dioxide, that are very simple to use, and they're very easy to use, and they leave no residue. And then there are things like, we know the household bleach at the right concentration is very effective. So, the chemicals, read the label, check with the manufacturers, and here in the United States, we're running into the same situation because not every, this is a brand new virus. Nobody has done the testing necessarily on some of those. So we're looking at what did we use for, or what did we prepare for SARS? What did we prepare for MERS? And things like that. The equipment, the use of microfiber towels, the new equipment that we talked about earlier, the electrostatic sprayers, such as the Victory sprayers, the BioPlanet units, the Tomy Steramis units. There are new pieces of equipment out there that are just fantastic. We also have played in, things like the iMop that's now available that will, clean floors. There's, really look at some of this new equipment that is now out on the market. It's very fantastic, and it does a very good job. Jeff, do you have more to say about that?
Tools, cleaning agents, and disinfectants are only effective when properly used. And let's define what they are, okay? Cleaning removes biological contaminants, disinfecting kills. But if we take our cleaners on there and all we do is move our microfiber towels around in a circular motion, that's not effective cleaning. So let me put a mental exercise in your mind very quickly. If I ask you to clean a table, you could buy, and you have 4 different people to do that, you could see 4 different techniques. But if I sprinkle sand on this table and I ask you to remove the sand from left to right, now imagine that each grain of sand is a pathogen or a piece of that coronavirus. Now you start to understand and start to see in your mind what effective cleaning is. And once all the sand is removed, we prepared that surface now for professional disinfecting. And while disinfectants available at stores make claims like 99.9% kills or 99.99, you have to read the label very carefully because there's a difference in contact time and dwell time. So if I knock over a glass of iced tea onto the table and wipe it up very rapidly, that's contact time. But if I spray my disinfectant on there and allow it to stay for 10 minutes, that's dwell time. A lot of the disinfectants have a dwell time of 10. Some of the ones that are 99.9 could be 15 to 20 minutes. Okay, we'll do that. And that means that it has to stay visibly wet for that disinfectant to work. If it dries before what the label lists as its dwell time, then it's not going to be effective. You will not get the desired results that you want or the claim that is on the label. So proper cleaning followed by proper disinfecting, and when you do both of those together, you are actually performing a biorisk management right there.
I'd like to add a couple of thoughts around the disinfectants and some cleaning tools as well. You'll find that some cleaning tools are chemical neutral, and other cleaning tools actually do not work well with some of the disinfectant chemistries. Let me give you an example. There's a very common class of disinfectants referred to as quaternary ammonium compounds. In the US, we refer to them as quats for short. But when you look at a quaternary ammonium compound, it can be a very safe and a very effective product when used at the right concentration and, as Jeff said, with the right dwell time. However, if you use it with a cleaning tool that is made of a natural fiber such as cotton, paper, or perhaps in some cases rayon, those natural organic materials will cause the quat to bind to the fiber, and the quat will not be available for use in deactivating viruses or killing bacteria. So if you're going to use a quat solution, again, quats are inexpensive and they can be very effective, and in some cases they're approved for food contact. You need to make sure that you're using a synthetic fiber. Now, one of the more common synthetic fibers that are used is microfiber, and microfiber works really, really well. In many of the newer hospitals, microfiber has been in use probably for 7, 8, 9, 10 years. However, not all microfibers made the same. Many microfiber products are made to be laundered, and one of the challenges of laundered microfiber is that when microfiber picks up dirt, it does not like to release it. And even a very effective laundering process will only remove 75 or 80% of the contamination. What happens is once that contamination is locked into the fibers, if it's dipped into a quat solution, now that contamination attracts the quat, and the quat again is no longer free to fight the bacteria or the virus. That phenomenon is called quat binding, and again, you can find information on quat binding if you Google it, or if you look on YouTube, you'll find videos that explain that. But ideally for infection prevention or infection control, use new microfiber. There are some new disposable microfiber products that are made to be used one time. So they're the microfiber equivalent of a tissue paper or a facial tissue versus a handkerchief that would be rewashed.
So one of the questions that is here is, or actually it's a statement, and I will say I 100% agree, and I think everybody here, well, we would agree, is the issue of disinfectants are more. The statement is more effective when you apply and leave on as a leave-on application, which means that the disinfectant should not be rinsed. Cleaners typically are put on and then taken off, but you're absolutely right that the effectiveness of a disinfectant is something that we will talk about dwell time. And so dwell time is one of those things that a disinfectant has to be wet on a surface for a particular time. And usually you'll find that again on the label. And so if the dwell time is 5 minutes or the dwell time is 10 minutes, you need to make sure that that disinfectant is on that surface wet for that length of time. And there are some disinfectants out there now that are, and I'll use the spray technology again, that you spray and then you just let it dry. And you're absolutely right. They're really effective if you don't have to wipe them off in those. But I'll reiterate again, read the label of the chemical and the disinfectant and the cleaning solutions that you're going to be utilizing.
Patricia, we have another question from our audience, from Mr. Abdullah. He asks, what is the most appropriate way to deal with a dead body, somebody who has died from coronavirus after they've died?
Well, that I don't really have a good answer for you on that. I haven't seen any recommendations that have been coming out from WHO or CDC, and I'm not sure what is happening right now in China. But I'm going to ask Dr. Stefan Wagner to answer that one.
Yeah, thank you for the question. Now, if you keep in mind that the novel coronavirus infection is primarily a respiratory disease, and the transmission, or one of the transmissions, is through the airborne route, a dead body will not actively expel any more viral particles. Okay, so it's primarily a hazard that is reduced to contact. So whoever handles a dead body should wear the appropriate personal protective equipment and make sure that they don't touch their face, their nose, their eyes, and then use precautions that actually allow them to safely manipulate the body, and then keeping in mind that depending on the family situation, that certainly instructions will be given to family members if the body is released back to the family, that whoever is handling the body follows the same procedures and keeps themselves safe, knowing that unless the body is actively disturbed, the coronavirus will not by itself being released from the body anymore.
Thank you for answering that. We have another question from Mr. Galal. He says that I believe at this stage it is important to do more analysis that at the airports. Uh, do you agree to that? Is there scope for improvement in the kind of analysis that our airports are currently doing?
You mean
The screenings, like they're doing the thermal screenings.
I think some airports that I've been through actually do a fairly good job of screening. Asking questions as far as the travel screening, doing the temperature monitoring, and obviously some equipment is better than others. I've walked through airports where they have the whole body, scan, and you see your temperature, pattern up on the wall, or up on the screen. So absolutely, I think that it depends upon the airport that you're talking about as far as if they could do more, and then what that is. That the interview, which takes it longer to go through security sometimes, but that interview process, which becomes very individual, as well as good temperature screening.
Okay, we have another question from Mr. Navdeep. Navdeep asks, what could be the disposing process for PPE? Where exactly do we dump it?
Well, that's going to be dependent upon your country's regulation. If it's, here in the States, people will probably, in a lot of situations, autoclave it and then be able to dispose of it into because it would be treated waste at that point in time, it would then be disposed of in what we would call just a waste facility. And then there's also the incineration. Here in the States, that's a little bit more limited, but we still would have that available to us. There may be situations where you would chemically decon things if it was necessary, if you really were dealing with a known infected patient. But a lot is going to depend on what is available to you in your own country and also the regulations of your country.
All right. Miss Sara asks, for passengers, is only wearing a mask enough for protection? And if we suspect any passenger at airports or hotels, how do we have to, react as professionals?
First, I want to clarify the mask issue again. So if someone is wearing the mask because they don't want to sneeze, they don't want to cough on someone else, they're trying to protect themselves from touching their nose and their mouth, that's where a surgical mask would be okay. If you are wearing it for real protection, as far as for true respiratory protection, then you really need to move towards a real respirator, such as an N95 respirator. And one thing that we talked about this week in our training is that N95s, you'll find them in different ways that they're made. Sometimes you'll find where they have what's called an exhalation valve, where there's actually a little valve on the front of the mask where when you breathe out your air, that valve opens, and so the air goes out. If you were the individual who had the coronavirus, that mask would not protect the people around you because you're expelling that air through that valve. And so you would really want to have an N95 respirator that did not have that valve. But knowing the difference and why you're wearing that mask or respirator is extremely important. And the professional part of it is, my dad always taught me, you always treat people the way you want to be treated. And I think the respect for human beings, our fellow man, our fellow women too. And it's one of those things where, you treat people the way you would want to be treated. And so respectful, asking questions. People who are ill, especially with something like this, are scared. And so, recognize that, and that compassionate part is extremely important.
Just one other thought around, is a mask enough on an airplane? I can't speak to the level of cleaning and sanitization of things like food service trays on aircraft. I know that some of the budget airlines that you find flying in Europe and in the United States, there's not very much cleaning that goes on at all. But I'm under the impression that for national carriers, for a lot of the Asian and Middle Eastern countries, the level of service is actually very high. However, as we mentioned before, it just takes one sick passenger to touch a tray to make that tray contaminated. And so for air travelers, they can use a mask, but they may also elect to bring hand sanitizer on board. Hand sanitizers can be very, very helpful when they don't have access to washing. Washing hands for 20 seconds with soap and water, warm water, can really go a long ways to preventing getting an illness. So if they're touching seatbelts, they're touching luggage, overhead rack door, the handles, washing their hands before they eat is a very, very important preventive measure. If for some reason they can't get to the toilet to wash their hands, a hand sanitizer is the next best thing, and is a good tool for air travel.
Thank you. It looks like we've covered all of our questions. At this point, I would like to request the audience to send us their questions if they have any more, and then we're going to wrap up. Patricia, is there anything else that you or any of the board members would like to cover about coronavirus before we wrap up?
I'd like to remind you that, right now, here in the United States at least, and a lot of parts of the world, we're dealing also with the flu virus. And, there is the confusion sometimes between the symptoms with flu and with also this new coronavirus. But what I'd like to say is how you normally would protect yourself against the flu, remember those aspects. Wash your hands frequently. Make sure that you're washing them with soap and water for at least 20 seconds. Use hand sanitizer when you can't wash your hands. It's effective against the coronavirus, and it's extremely important. Cover your mouth when you sneeze and cough. Go ahead and, stay home when you're sick. I'm giving you permission. Make sure that if there is somebody ill, don't keep your distance. Those are some of those really key and important things to remember. And from a cleaning and sanitation, as Jeff had indicated, we clean, and cleaning is a different step than disinfection. And it's extremely important. You cannot disinfect a dirty surface. And so that cleaning step is extremely important. And that disinfection process is important. And also, we'd like to thank you for this opportunity. Everybody have a wonderful day, and thank you very much. Anybody else have anything to say? No?
Thank you.
Thank you.
Thank you.
We have two more questions. One is from Sarat. It's that this person has heard that coronavirus can spread through eyes. Is there any advice on that?
Yeah. Well, with the contamination, if you have it on your hands, what we say is make sure that your holes, as far as your eyes, your nose, your mouth, that you don't want to get the contamination in your eyes, your nose, and your mouth. And so avoid touching your eyes. And then also, if you're in a situation where you're going to be around a patient, make sure that you have in your personal protective equipment eye protection. You may have a disposable face shield. If you're wearing a powered air purifying respirator, that provides you that protection as well.
Okay, another question from Navdeep. It says that people compare coronavirus to Spanish flu. which happened 100 years ago, and a lot of casualties happened. Is this virus similar to that?
No, it's not similar to the flu, but it is similar to SARS, and it has some similarity to MERS.
Okay. I think we have covered most of our questions, and we'd like to thank you, all the board members of GBAC, and all our listeners for your time and the detailed discussion that happened around coronavirus. It was the need of the hour. We appreciate you being here and hope this brief session has helped you gain perspective on how to combat coronavirus. For those who haven't done it already, you can now download our free ebook in association with TCL, which talks about combating and coronavirus, and especially highlights the top infection control measures across hotels, hospitals, and airports with some efficient cleaning solutions. Thank you once again for joining us today, Patricia, all the board members of GBAC, and we hope to hear from you once again. Thank you.
Thank you. Bye-bye now.
Bye-bye. Have a nice day.
Mhm.
Wow.